Welcome, everybody, to Ask a Black Doctor about COVID-19. We appreciate you joining us today. Black Doctor is a collaboration between One Hood Media and the Gateway Medical Society. It really came out of the fact that, we entered into this global pandemic in March. And we began to want to have conversations specifically in the Black community about COVID-19, what it was about, and how we can best survive during this global pandemic. We started with the town hall, what Black Pittsburgh needs to know about COVID-19, with Dr. Jamil Bey and Urban Kind and Black Woman, Wise Women Incorporated, featuring Dr. Cheryl Hall Russell. And so we started to have those conversations. I remember we had some doctors early on. And I remember at one point reading an article about, I think it was a coalition of Black doctors in Philly. And I remember thinking to myself, man, I wish we had a coalition of Black doctors in Pittsburgh. And I got contacted by Dr. Rhonda Johnson. It's like, oh, we do have the Gateway Medical Society that's been in Pittsburgh very long time, advocating for Black healthcare workers and Black doctors and nurses. And so it's been a blessing really to be able to come to you every other week and hear directly from medical experts that look like us, that share our similar experiences, and to help us navigate through this global pandemic. The reality of where we are right now as a community is that, every time you step outside of your house, you have to think, medically now. You have to think about, do I have hand sanitizer? Do I have, or at least you should be. I mean, that's also something we got to talk about. We should be thinking medically. And so, we have two doctors with us today. Dr. Rhonda Johnson, who is really, one of the doctors that spearheaded this collaboration and has been with us a few times. You're a veteran, Dr. Johnson. And we also have Dr. Anita Edwards, who is a first timer on Ask a Black Doctor, but appreciate you taking the time. We know you all are busy. Well, we want to congratulate you, Dr. Johnson, because you just retired. And so you have a little bit more time to spend with us. But we know you all are busy, particularly now more than ever. We know a lot is being asked about, and so we want to obviously thank particularly, the frontline healthcare workers in this moment that have stepped up and are really risking your lives to provide folks with healthcare in this pandemic. And we want to thank you all for coming on, bi-weekly to have this conversation with specifically Pittsburgh's Black community. We want to say, so I have a question already. I like that. We have a question right off the top, and we're going to get to the question shortly. But we do encourage you to ask questions. We're going to talk about COVID-19, but we also want to talk about the flu, this twindemic. And I don't know if that's language that you coined, Dr. Johnson, but I really like that terminology, this twindemic that's happening right now. And so I want, to maybe we'll start with you, Dr. Edwards. If you could just introduce yourself, talk a little bit about your background, how you got into the field you are right now. Then we'll go to you, Dr. Johnson, and we'll kind of get into this discussion of where we are right now. Dr. Edwards?
Well, hello, everyone, and thank you for inviting me to be on this show. I have watched various episodes, and they have been great and very informative, and I am proud to be on today. I am Anita Edwards. I'm from Pittsburgh, Pennsylvania, and this is my home. I am an internist. I do adult medicine. I practice out in the West Mifflin area for about 26, 27 years. Presently, right now, I work for Gateway Health Plan as a medical director. Some of my passions is definitely working with disparity and in healthcare. I am also a member of Gateway Medical Society, and I'm just glad to be on.
Absolutely. Thank you for coming on with us. And Dr. Johnson?
Hello, I am a veteran, as Jasiri mentioned. Glad to be here tonight to help represent the Gateway Medical Society. And first, I want to thank you for what has been a wonderful partnership. Since May, we have been providing information on COVID-19. We were fortunate because we received funding from the the Gateway Medical Society, funding from the Heinz Endowment and from Highmark Blue Cross Blue Shield to provide this programming, to provide information from African American physicians and healthcare professionals about COVID-19 and other health conditions that affect our communities of color. And by the way, I'm a pediatrician like Dr. Edwards. I too am a home girl, born and raised in Pittsburgh, Pennsylvania.
Oh, and that's positive to see, Pittsburgh being represented today in this episode. So let's kind of jump right in to the conversation. So first of all, let's go right to this question, because question was any holistic physicians. Now, I'm not sure what that necessarily means. If somebody says are all physicians holistic? Is a holistic physician like a specialty? Drop some on me.
So there are some physicians who practice holistic medicine. Some people call it alternative medicine. And I think the closest I know right now is actually, he's been on the show several times, is Dr. McGowan. He is probably the closest that I know right now. That's holistic. Sometimes it is physicians who've gone through traditional training and then go back and become holistic, or there are schools that actually train just in holistic medicine.
Okay.
Yeah, and I'll add to that, both Dr. Edwards and I are what is called allopathic physicians. We went through traditional medical schools here in the United States. I'm a graduate of Penn State College of Medicine, and Dr. Edwards is a graduate of Howard University College of Medicine.
All right. Yeah. So I want to first ask, I think, the big news this week was the introduction of the COVID-19 vaccine. I believe it was two companies, right, Pfizer and Moderna, who introduced this vaccine. And one of the big news was that kind of behind this vaccine, or the creation of, I believe Moderna's vaccine, was a Black woman scientist. If you can play that first clip about Dr. Covert, John, and we could kind of hear it from her own mouth about her working on this vaccine. Can you play that clip, John? The Dr. Covert. Yes. Yeah, that one.
For equality, a Black female doctor is on the forefront of developing the COVID-19 vaccine for Moderna. Dr. Jasiri X is the lead scientist for the National Institute of Health.
Ron, she says she understands why communities of color might be hesitant to get the vaccine, but Dr. Corbett also stressed they are safe and effective.
For the general population, our target goal is for next spring, and that is if all things go well, and if these phase 1, phase 2, and phase 3 clinical trials work simultaneously for the good, our plan is to have people vaccinated all over the world by next spring.
A recent study revealed only 14% of African Americans trust the vaccine will be safe.
So before we get into that second part of that clip, because I do think that's important, just general reaction, like how do you feel? I mean, as Black women in medicine, I'm sure you all have stories about, and we probably could spend the episode just about some of the discrimination that you all have faced personally as Black women in medicine. How does it make you feel to see a Black woman scientist, kind of at the forefront of creating this vaccine?
Well, we're always proud of whatever African Americans are doing. So we are proud of her and all her accomplishments. It is nice, I think, that for once, not only is she a female, but she's African American, and we're just finally getting the recognition of what we do and how we have helped the country. We know for years African Americans have been the inventors and the ones on the foreline, putting out things that really have helped the country. we have a whole month that is supposed to help us understand that. It doesn't always work. So she's not probably new, but it's just that we don't recognize always what we have accomplished. So it is great to hear that she's getting her recognition.
No, right. I mean, a lot of times when it's sometimes, you know, in these moments in history, there were African American scientists there at the forefront, but not getting that recognition and not getting their name put out there. Dr. Johnson, how did you feel?
Well, I'm not surprised at all because, as Dr. Edwards said, we are everywhere. We are essential to the well-being and the advancement and in every area. There is not an area of science or medicine or entertainment or sports or education or engineering or architecture. I mean, African American slave laid the blueprint for our nation's capital.
True.
So really, this should not come as a surprise to anyone.
No, I mean, I think it's powerful to see. Like I said, particularly, and I'm sure that you know, once again, I mean, unfortunately, the way, and this is one thing we tackle at One Hood Media, you know, the way the media will have you believe that we're just, you know, entertainers and sports figures. And so I'm sure there's times where you probably, I mean, we just had a whole conversation about, you know, folks not wanting to call the vice president's wife, Dr. Jill Biden, and that whole piece. And like I said, I'm sure that you all probably use doctor and been questioned about that, or, you know, why are you at the hospital, whatever. And so it is powerful to see, particularly even just for the generation or the next generation to be inspired. But now that second part was that, you know, and this is something that I saw today. It said only 14%. I mean, one of the things that we did see, I believe the first person they showed get the vaccine was a Black nurse, frontline nurse in New York City, get the vaccine. It was given to her by a Black healthcare provider. But at the same time, so we're seeing a Black woman, like how do we explain that? We're seeing a Black woman, you know, leading the you know, the research around developing a vaccine. We're seeing a you know, Black frontline worker getting the vaccine from a Black healthcare worker, but only 14% of Black people. I mean, most of the conversation in the Black community is we ain't taking it. You know what I'm saying? I'm a wait. So how do we, you know, reconcile those two things?
Well, you know, always trust is always going to be an issue with our community. We just don't trust the medical field. It's out there. It's not new. It's and we seem to hold on to things of old. I mean, you can't negate that the Tuskegee experiment happened and that we were the ones that was used. You know how we've been used as experiments for gynecological surgeries. Women, you know, as African Americans, we have reason not to trust. So it becomes very hard for us to hear, even from our own, whether or not we should be doing something that is probably helpful to our community, but still we're going to be leery. I do think, you know, you were saying, or I think she said how hopefully most of the people will start getting the vaccine in the spring. And I was saying to a group of ladies that I was talking to, I said, I thought that probably will help, maybe, hopefully, because by then you will see more of the side effects. As we're seeing more and more people vaccinated, then you will see more of the side effects or lack of side effects, is what we hope. And I think if we see that there is lack of side effects, but we are seeing that people are truly being helped, that hopefully that will help the message in our community.
Absolutely.
And I would like to say too, that, you know, I don't work in the media, so I don't know why certain messages and stories and narratives are told by the media. But the way I look at it is that here we see Black doctors and Black nurses who have been on the front lines of this pandemic, and they have treated disproportionately a number of critically ill Black and brown people. And so they understand in real terms. No one probably understands it better than they do. They have made the calls to the family, telling them that their loved ones are no longer in the land of the living. So we should feel encouraged. I felt proud that African American professionals, the message I took away is that they understand, they believe this vaccine is going to work. They're not afraid. They have trust in the science of the vaccine. And yes, here we are frontline healthcare workers, and we're taking this vaccine because we believe in vaccines. And I think that we need to change the narrative. And I've talked to many African Americans whose voices are not being heard or whose voices aren't being surveyed. So I do think there are more African Americans who are going to take this vaccine than are being surveyed. I think it's evolving, just like the tide seems to be changing through all of this media exposure. I mean, probably for 2 weeks, we're going to see a lot of people get their shots in the arm, including public officials. And so I do think that all of this information is going to help people feel a little bit more comfortable with this vaccine. And I think it's on the professionals such as Dr. Edwards and I and the Gateway Medical Society and Black healthcare professionals to help get this message out to communities of color, because they are more likely to trust us than they are to trust other people who are speaking to them on television.
No, that's true. And I did want to follow up with that because you kind of echo a similar sentiment that Dr. Fauci said. Dr. Fauci did a town hall with the website blackdoctor.org. Can we pull up that clip of Dr. Fauci, John? And he kind of talked about, the fact that, I guess he kind of gave his reasoning where he felt like this is why Black people should be, I guess, willing to take the vaccine. Throw the clip up, John.
A lot of people are skeptical about the vaccine, some because it was developed so quickly. But for some African Americans, there might be historical concerns. It dates back to the 1932 Tuskegee study. Researchers were looking for a cure for syphilis. The study included nearly 400 Black men who had the disease and 200 that did not. Instead of giving the penicillin treatment to participants with the disease, the doctors studied their decline of health until they died. In 1973, a class action lawsuit was filed on behalf of participants and their families. The U.S. government paid out $10 million and gave lifetime medical benefits and burial services to all living participants. Dr. Anthony Fauci addressed the concerns. He says he understands, but believes the vaccine is safe because Black scientists were at the forefront.
Oh, what happened? what happened? We was about to get to Dr. Fauci and they cut off. Did the clip stop or did the clip stop, John? It just cut off. All right. Well, Dr. Fauci was about to go in about the fact that he felt like, okay, wait, we can bring it up. Yeah, bring that back up. Let's see.
In my institute's vaccine research center, by a team of scientists led by Dr. Barney Graham and his close colleague, Dr. Kizzmekia Corbett. So the first thing you might want to say to my African-American brothers and sisters is that the vaccine that you're going to be taking was developed by an African-American woman. And that is just a fact. I mean, that is a fact.
Dr. Fauci also says African Americans have been disproportionately affected by coronavirus. He says Black Americans make up 4 times the amount of hospitalizations and twice as many deaths.
So should that do we think that is the fact that a Black woman was will that, is that the information that Black people need, or is there something else, kind of like what you said, Dr. Johnson? Is that personal care or that personal message from like doctors that they know, like we know you, we know your commitment. Dr. Edwards, you both were born and raised in Pittsburgh. You've been in medicine for 26 years. Is it that more of that personal touch?
So I think it's more of the personal touch. I really do. I think it's those of us who are in the health field getting out and telling others that it's okay. I think that's what they need. We need to be telling our church members. We need to be telling our friends, our whatever association we belong to, we need to be putting out the word that it's okay. I know Dr. Johnson, she has a following on Facebook. I hear about her following, of how people are just following her advice about what she says about COVID. So, I mean, I think it's those kind of things that will help our community understand that it is okay to get this vaccine. I have people that are still afraid to get the flu shot. And I was just having a conversation with the group just the other day about how it's okay to get the flu shot. And they have doctors, but they wait to hear from me or ask me, is it okay? So I really think it's us helping our community understand the safety, even if we're not their actual physician.
Absolutely. You've shared that experience, Dr. Johnson?
Yes, I do. And there is just so much misinformation. And really, there is a high level of distrust in the mainstream media with African Americans. And I think that's why the services that you do, Jasiri, are so important. I think, Black people want to tell their own story by people telling their story that they trust, and too often, like Dr. Edwards said, the only stories that are told in the media about African Americans are either negative or in some ways unfavorable. So what we're probably seeing is a little bit of backfiring. I think the intention may be good, but it may be having what's called unintended consequences. And so I just hope, time will help sort this out. And again, we appreciate these opportunities like today to get the story out in our own words, because I think the studies have proven over and over again that African Americans are much more likely to trust information that comes from African American physicians.
And you make a great point, and I want to, because I do have a follow-up flu question, and then we'll get back to some of the COVID stuff. But the reality is, just like you said, if everybody takes the vaccine and it's good, it's not really a story. You know what I'm saying? Like, I mean, right. The flu shot has been around. I mean, the flu shot has been around every year. You don't really hear about, at least I can't remember hearing about somebody necessarily having a negative, response or dying from the flu shot or being severely injured from the flu shot. It comes around every year. Do you think that maybe because of all of this vaccine talk is making people even more fearful to get, because how long has the flu shot been around? It's been around for decades, correct?
I think we have to take the whole context of this whole COVID pandemic. Unfortunately, this whole pandemic has been politicized.
True.
And the impact has been very negative. I mean, we see a whole group of people that protest being asked to wear masks. People are not adhering to any of the public health recommendations from, not traveling. The public health community said, don't travel for Thanksgiving, please. Again, guess what happened? 48 million people travel. So we're just seeing a backlash. And again, unfortunately, this outgoing administration, I don't want to talk politics, but they perpetuate that. You had the president of the United States discrediting the CDC. He discredited Dr. Fauci. He discredited all the doctors and experts who even worked on the White House Corona Task Force. So, I think public health, I think healthcare, I think messages from doctors and nurses, we're just going to have to work hard to try to rebuild trust.
No, that's a great point. And also like encouraging folks to ask questions. I see there's a question about the vaccine. I'm gonna get to that question, but I first wanted to talk a little bit about an article written by, I know folks call him Dr. Noble. He wrote it in the public source, and it was specifically around COVID and the Black community in Allegheny County. And I want to read a little bit of what he said. He said, when we break the numbers down, we see that neighborhoods with the highest COVID test positivity rates are predominantly populated by Black residents and other persons of color. These neighborhoods include Larmer, Manchester, East Liberty, and Homewood. He says the Asian population COVID test positivity rate is 31% in Allegheny County, with the Bhutanese refugee population being particularly hard hit. As of December 4th, the 14-day positivity rate for COVID-19 tests among Black individuals was 30%. In some neighborhoods, overall COVID-19 test positivity is as high as 50 to 76%. The Center for Disease Control and Prevention guidelines tell us that community spread is classified as severe when COVID-19 positivity rates are 5% or higher. And so what does that say? And what steps should we take if in about, I live in East Liberty, in the Black community, like our positivity rates are 30 to 50%. Like you said, we just had things, Christmas is coming up. This is a holiday where, again, folks like to get together. You want to give that person that gift. You want to kind of see the reaction, the smile on their face. What steps should we take in our communities when the positivity rates are that high? I'm sorry.
So number one, I think we as a community have to understand this disease is real. I still think so many people don't believe the disease is real. And so I think that's the first step, is that we have to believe it's real. I then think, again, those of us who have the knowledge, even though we're on shows like this, we have to go back to our communities and talk to the people in our community. It can't just be shows or news clips. It has to be one-on-one face talk, letting them ask questions, being able to give them true answers to their questions, because I think that's the only way they're going to trust what they're hearing, is that you can give them the answers that they want. And everyone doesn't know what that question is for other people. So we really need to be talking to our families, friends, and whoever we can about what's going on.
That's kind of like we had that conversation earlier today, Dr. Johnson. Is it do we need like more, almost like, like doctor foot soldiers to kind of go in our community and spread this message?
Well, I think two other things, there are some basic things that are contributing to this. Number one, you may have more people living in a small space in communities that are referenced as 30 to 50%. Like, for example, in the Bhutanese immigrant community, you might have multiple families in one household or multi-generational. It's not uncommon for African-American families to live in a home where you might have a grandparent or a great-grandparent or relatives, or, oftentimes we offer space to people who may have been disaffected or may have lost their jobs or lost their homes. So you can have multiple families, and anytime you have people are the source of this transmission of this virus. So some things that people are going to have to do, they're going to have to pay more attention to, ventilation, opening up those windows, even in the wintertime, turning on the bathroom fans, getting some of that infected air to be exchanged with fresh air outside. That is one thing. The other thing is people have a, over reliance on public transportation.
True.
And so they will have to, make sure that they're using hand sanitizer, washing their hands when they get to their destination, and wearing the mask. And probably what's going to need to happen, again, this disease is so contagious. So what you're seeing is probably household transmission. You're seeing people who are getting infected in their households. And it's very hard to stop COVID transmission within the household setting. So, you can wear masks and things like that. And then some basic information like not sharing utensils, doing a little bit more disinfecting. We'll have to see, what the opportunities are, but there probably needs to be a lot more education. And like Anita said, people need to understand that this is real and that, the numbers are increasing and people have to take some extra steps. Now, as far as the holiday is concerned, it will be very important for us to break up the tradition that we've normally had. Folks just need to let go of any plans to have big dinners, big celebrations, big holiday parties. This is just not the year. Like you mentioned, the article about Santa Claus in Georgia, people went to see Santa, sat on Santa. Santa and Mrs. Claus had COVID. So we can't do that this year. If you're going to see Santa outdoors or see Santa virtually. Set up a virtual appointment with Santa, and if you absolutely have to have celebrations, well then go outside, have an outdoor celebration, no matter how cold it is, or just stay with your immediate family this year and call everybody or do virtual family visits.
No, that
And
works.
I just want to stress that last thing Rhonda just said, because that's what I was going to say. We have to truly understand who our bubble is, and we have to stick to our bubble. Just because it's a holiday, you can't break that pattern. I don't care how close the cousin is. I don't even care how close your sister and brother is. If you're not associating with them on a regular basis and already know where they go, then you can't include them in your holiday celebration. And I think that's going to be the hardest part, but we want to live. I think if nothing else, we want to live. And I think we have to emphasize that this is probably the worst time, because as Rhonda was just saying, we're in closed ventilation, houses are closed, heat's ablazing, and it's just a perfect environment to pass this virus. So people really have to figure out how to socialize, either on medias like this or outside, like she said, as opposed to going in a house. And I know Black people don't like to be cold, but we have to figure out how to do this without sitting in someone's home and spreading germs.
Absolutely. That's that old school Black teaching, like open the window up and get that fresh air in here.
That's right.
Go back to that. So I do want to get to some questions because I saw two questions kind of about the vaccine. The first is from Jane Nicholson. It says, question: for each of the vaccines approved for emergency use, do you know the percentage of African Americans who participated in clinical trials? Has that information been made available?
Yes, I will answer that if that's okay. If you go on either Pfizer's website or Moderna's website, they have detailed information around the diversity of participants in their clinical trial. Now, unfortunately, African Americans have a low historical rate of participating in any clinical trial, but these vaccine trials, they went the extra mile to have diversity. And they not only have gender diversity, they have racial and ethnic diversity. And on all their websites, they list the percentage and the numbers of people who participated in their trial in the United States and in the other countries where they did the trials. So Pfizer, I think, don't quote me on this, but I think they had around 9,000 African Americans that participated in their trial. I may be overestimating that, but there has been diversity in all of these clinical trials.
And, I don't think it's not that they reach out to us to be in the trials. I actually just got a notice today, I think from the University of Pittsburgh, to ask me to participate in a COVID vaccine trial. So we can't blame them if we're not part of the trial. We have to roll up our sleeves and be part of these things if we expect to know how it's going to affect us at the end. So
yeah, and I know that was part of the work that Father Abernathy was doing that was highlighted in the New York Times. And so, just wanted to appreciate the work that he's doing. This question is on similar lines. And I think one of the things that folks were saying, at least, that were, I guess, skeptical about the vaccine was how fast it was developed. Somebody said, I'm not in the medical field, so do you think the vaccine from a clinical research standpoint has had time to be tested in a broad enough audience? Is the quickness of it something that people should be worried about?
So, just to be honest, I think, you always have to have honest conversation. And every drug, no matter what it is, has a certain amount of people that are in the test part of it. And then after they release it to the community, you may see other things come out just because there are now more people involved. So I don't know so much if it's just the time or the number of people. So as we move through this and more people, as I said before, as we move through this and more people are involved, I don't think anyone can say that we're not going to see anything else. We hope we don't, but there's always that potential that we may. But again, the more people who are involved in the trial part, then the more likely we would see the things that are going to be wrong with the vaccine before it comes out, if there was an issue. What we have seen from the people that was involved, there was very little side effects with this. And so that's what we hope, that it continues in that way. I mean, you do see the news, and I think one lady had some kind of reaction when Dr. Fauci has tried to address those. And you're going to see those, but you have to understand the incidence of those are probably very low. And again, as we was talking earlier, the news is going to broadcast those things that are wrong. They're not going to tell you how many people have received the vaccine and they're doing okay. They're only going to tell you of the ones who are not doing well. So we have to ask the true facts and say, well, that's one. And I know you don't ever want to be that person who has the reaction, but still, you have to look at the numbers and say that was 1 out of 100,000, 1 out of 200,000, however. And, so what is the likelihood that that's going to happen to me?
And I would like to add, okay, I would like to add that these vaccines are developed by career lifelong scientists and by vaccine producing company. So every vaccine you make builds upon the knowledge base from previous vaccines. So for example, this RNA, messenger RNA technology, Moderna had actually developed this for the Zika vaccine. They already had the process figured out, ready to go. But then with the mosquito eradication that occurred around the world, Zika died out. So we don't hear anything about Zika anymore. So they were able to apply that technology that was already developed for the Zika vaccine over to the COVID vaccine. So once that gene became, the genetic sequence became available for this virus, the Chinese sequenced it, gave it to the world. And once you know the genetic code, you can develop vaccines. I want to say to the public, vaccine development is kind of twofold. And really the gift to us is that this coronavirus, this SARS-CoV-2 virus, it doesn't mutate as fast as other viruses like the HIV/AIDS virus has mutated and the influenza virus. So they've been able to develop a vaccine that works and is effective against this SARS-CoV-2 virus. Now, the part of the reason they haven't been able to develop a vaccine against the HIV virus is because the virus keeps mutating. It mutates so fast, they can't develop an effective vaccine. So I just want to reassure people that science helped develop this vaccine. And yes, it is true. We do not have a long-term safety profile with this vaccine. It's approved under emergency use authorization due because of this devastating nature of this pandemic. If we do nothing and just allow this disease, this pandemic to run its course, millions of people are dying. Worldwide, millions of people have died from this COVID-19 pandemic, and millions more will continue to die. So people really have to, what they should be looking at, they should be looking at their personal risk factors. If you get COVID-19, folks, it's a personal infection. It's between your body and this virus, whether or not you live or die. It's a combination of your risk, your comorbid conditions, your pre-existing conditions, like if you're overweight or if you have high blood pressure or if you have diabetes, and if you're a person of color, you're much more likely to have all of those things. So it's a race, really. It's a race to try to get a vaccine that is effective. And these vaccines are even 70% effective. The AstraZeneca vaccine, that's more effective than the flu vaccine that we give out today. So people need to think about this in terms of their own risk. And they have to really ask themselves, look, do I want to take a risk on getting a vaccine? Or do I want to take a risk on getting this disease? And which one might be, I might survive.
And as Rhonda was saying, that the difference also between the flu and this virus, the flu goes away for a while. I mean, it usually peaks. It has its bad time during the fall, winter, and then by spring, it goes away for a while. So we have a period that we can overcome, we adjust. But with this, it doesn't seem like, it's been for 9 months, and so it goes through all the seasons. So it's not going to go away next. You can't say, oh, when spring come, oh, this will go away. It's going to be here again still in spring. And then we don't even know whether you build an immunity to it. So even if you've had it once, you still don't know that you won't get it again. So if people don't get vaccinated, we heard a talk about the herding effect and how you have to vaccinate so many people in the community before any of this is going to work. So the only way for us to get this virus under control at this particular time is that a lot of people get vaccinated so that we quit spreading it in the way that we're spreading.
No, I really appreciate, the expertise of you both. And that I was, it just, when you both start talking, I'm like, I don't know a lot about this thing. So I'm so happy to have you all on. But I think, sometimes because we see these numbers every day, but you're talking about 3,000 people a day dying. I mean, I think that's the reality we have to remember. We've lost over 300,000 people. We have, we hit over 3,000 deaths a day, and what that means in terms of losing folks so often. And so thank you for kind of bringing that back to, some of that personal stuff, because sometimes I think we can talk about it in these abstract terms and forget that, like, there are people dying every day. There are people losing family every day, and that need comfort and they need help and need guidance. I do have a good question from Dr. Villalobos. It says, do you think if minority providers start getting the COVID-19 vaccine, if this will encourage people in the community to be open to getting flu vaccine and COVID-19 vaccine once available to the public? Should we wear something to display that we have received the COVID-19 vaccine and we are okay? I actually think that's a great idea. You know what I'm saying? Like, because I think
give us our badge.
Yeah, like, how would you know? Like, like our voted sticker, like, I got vaccinated and I'm good. So what do you guys think about her question?
I get the flu shot every single year. Let's talk about the flu vaccine a little bit.
Yeah.
So, like Dr. Edwards said, the flu is seasonal, and the flu virus mutates so much that you have to get a new flu shot every single year. We don't know anything about COVID, the coronavirus, yet. We don't know, like she said, if the immunity is going to last long, or if we'll have to get a new COVID shot every year. Time will tell. We're in the midst of this brand new pandemic that's never been seen in humankind before. So again, we don't have all the answers, but for the flu, we do have the answers. So yes, you have to get a flu shot. Again, the only side effect I've ever had from the flu shot, I've been getting the flu shot probably since I started medical school. So let's see, when was that? I won't tell my age. 1978, I've had a flu shot every single year. So that's a long time, and I think I'm pretty healthy. So, it's only side effect I ever have is soreness in my arm. And that's usually just for a day or so. And I always get it in my non-dominant arm. So, but I would be happy when I get the flu shot, I'll be the COVID shot out, the COVID-19 vaccine. I'll be happy to show anybody that I've got that COVID-19 vaccine.
And Rhonda, and I'm gonna tell you, I have had the flu, and I was one of those stubborn people at first. I had the flu, and I got it while I was in residency. And after I got the flu, I said, I never want this again. I don't know what COVID is like, but I know the flu is horrible. And that made me know that I wanted my flu shot. So right now, most of us can't even get the COVID vaccine. So what you can get is the flu shot. So get the flu shot. At least that protects you from the flu. As you were talking about a twin-demic, you would never want to get the flu on top of COVID. That just sounds, I don't even know how to describe that. There's a place that probably resembles that. So, you just really don't want to you want to get your flu shot. And what we understand is you can't get them at the same time. So while the flu shot is available and while you can't get the COVID shot right this moment, go out and get your flu shot. It takes 2 weeks at least to build up an immunity to the flu with the flu vaccine. So a lot of people think, oh, I get the flu, but maybe what you just did is you got the flu because you hadn't gotten the shot early enough. We really encourage you to start getting the flu shot in September or October. There used to be question about whether getting in that early and would it last, but we still say get it early. So I think only 1 year have ever heard they say you may need to get it twice if you got it early. So for most part, it lasts us for the whole season, and you can prevent the flu. And it's the same precautions. I said it's a shame that we had to come up with all these precautions for COVID. Really, we should be doing the same things. We should be covering ourselves when we sneeze. Maybe we should have been wearing a mask for the flu, who knows? We should wash our hands. We shouldn't share things with other people. We shouldn't drink. We shouldn't, all the things that we've been telling you for COVID, it was the same things for the flu. It is just public hygiene that we need to learn and to help prevent these things from happening.
So I
And I want to say, Jerry, you can get a flu shot in a lot of places. You can get a flu shot at your doctor's office. You can get it at like Walgreens, CVS, a federally qualified health center. You can get free. They have free flu shots that are being offered by the Allegheny County Health Department. So, and it's not too late, folks. It's not too late. Get that flu shot now.
So I did have a follow-up flu question about the flu shot. This is from Blair. It says, with the potential of various strains, such as with the flu, is there a need for a modified version? As of today, I've heard at least 4 strains. How many strains were they cover? I don't know. Is that about the flu or is that about COVID-19?
Well, I'll just answer for the flu.
Yes.
So, okay, there's a trivalent, which covers 3 strains, and then there's the quadrivalent flu vaccine. So if you're 65 and older, your doctor will likely write Anita. I do the pediatric,
Right.
He does the adult. So go ahead and tell them about
So for adults, there is something we call high dose. That's what we usually tell people. It's a high dose vaccine, but it's the quality, and it has 4 of the strands. So for older people, anyone over 65, that is what they should be getting. And then the regular population gets just the regular flu shot. Also, realize that these are not live viruses. They are dead viruses. So no one's injecting you with the flu. That's what people think. Oh, they're injecting me with the flu. No one's injecting you with the flu. Many people are scared about egg allergies. And for years, yes, it was grown in eggs. But here recently, the new technique is they grow it in mammal cells. So it's no longer grown in eggs. So people can't use the excuse that they're allergic to eggs. And even when it was grown in eggs, there was so little reaction that people still could get the flu shot. There is a other flu shot for young, and Rhonda can talk about that one. There's a nasal one, and it does have some live parts to it. And maybe Rhonda wants to talk about the children and the nasal.
Okay, so just real quick for children, if children can get the flu shot 6 months and older, and pregnant women also can get the flu shot. So basically, the only people who cannot get the flu shot are people who are 6 months and under. And if it's the first time for a child, then the flu shot will have to be given 2 doses. They'll have to divide the dose in half. And so it'll be like the COVID vaccine. You get half dose and then you get the other half dose a month later. So children, if it's their first time, then when they're young, up until maybe age 3 to 8, they'll get a 2-dose flu shot just for the first one. And after that, they can just get 1 shot.
Thank you very much. So I want to bring up this other question. This is from Kiana. And it says, any tips for safely attending funerals during this twindemic? And this is kind of personal to me. You know, our community just lost a young man. You know, there's a brother, Rashad Birdsong, and his family have been doing a lot of work in our community, anti-violence work for many years. They just lost their grandson to gun violence, who was 15 years old. There is a memorial tomorrow that I plan on going. You know, they're telling people, you know, please wear masks, please be safe. But are there any tips? You know, like I'm somebody that I want to, you know, physically go and show my appreciation, and show my, you know, and grieve along with my family for the loss of this young man. Are there any tips that you could give folks going that would just help us be even safer in that environment?
So, I think it's the same things we've been saying over and over again. As you already said, you need to wear your mask. You have to still distance yourself. I heard people say social distancing is the wrong word, because what you really need to be doing is physically distancing. So if you're around people, you still need to keep that distance in between. Don't mean you can't have a conversation. I know we love to hug and we love to comfort and wipe away people's tears, but those are things you got to avoid in this kind of situation. Many people think they can put on gloves and that's going to make them safe. But if you put on the gloves and still wipe your face, it's the same as having it on your hands. So, gloves will not protect you if you still don't remember not to touch your face or your eyes or your mouth. So that's why hand sanitizer, if you touch something, carry some hand sanitizer and clean your hands as much as you possibly can, and congregate outside as much as you can. Try to be outside. That's the biggest thing. I know my father died earlier this year. I was blessed. It was September. And so therefore we were able to still move people outside. I think, as I said, I think that's the hardest part about this season, that it's cold. We don't like being cold. There's 8 inches of snow out in my driveway that I can't get rid of, so no one's going to want to stand outside. But if you're determined to go to these events, you need to think about, how can I be outside more than inside? How can I keep myself distanced from people? Because realize, even if you don't have a mask on, the way this stuff spreads, people say 6 feet, but it can be 16 feet. So you have to wear the proper mask. I see so many people. I was in Giant Eagles and I saw the young man have those things that you just pull up over your face, and those are not safe. They have to be at least 2 layers thick if it's of cotton material. The ones that are disposable are usually 3, but just putting something like a bandana or something like that over your face, you actually probably can still spread it even more. And you don't want the vented kind of mask. So you just have to make sure you're wearing the right kind of mask. I know Dr. Johnson gave you all much instructions about, if you're sweating in your mask, you need to carry more than one. So see, I do watch you. And so that's just it. I mean, I know how much you want to be with your friends during this time, same as the holidays, but you just have to make sure that you physical distance. I think that's the magic word, physical distance.
And if they have virtual service, would be an opportunity as well. Maybe somebody could intervene and ask them to spread the word about the link, the Zoom link or something, so that more people can still participate, but they can do it virtually. We have just got to, because what's happening, this is how COVID spread in Albany, Georgia. A family had a funeral. Then 2 weeks later, 28 people who went to that funeral got sick, and a number of them died. And then you've had events that, one conference in Boston ended up affecting 330,000 people in like multiple countries around the world. We just have to, we have to be mindful of the reality of today with this virus. And if there's an opportunity to make that ceremony, that remembrance virtual, because what you don't want to see happening is people come to offer support to the family of the deceased. And then 2 weeks later, you have 10 more people that are dying because they went to this memorial service. This is a special time. And if we can get through the other side of this pandemic, I've lost friends, I've lost loved ones, and I've watched, unfortunately this year, way too many virtual funerals. Yeah. But it was a way for me to participate and support the family and the deceased member.
I know of a story of a young lady had an event. It was a funeral and people came, and she had 10 other obituaries from that funeral. So it's real. I mean, it is truly real.
No, thank you both. For your words of warning, encouragement, inspiration. We have 5 minutes to go. Any last words, final, information that we want to get out to the community around, whether it's where you get your flu shot or any other updates that we have?
I would just like to say that the symptoms of the flu and COVID-19 are very similar. You won't know which one you have. Both can cause cold symptoms, sore throat, fever, muscle aches and pain. Vomiting and diarrhea is very common in children, and children can be very sick from the flu, and from COVID-19, they can pass this virus and show no symptoms, whereas the flu tends to make children very ill. But one thing that's different about the flu and COVID is the lack of taste and smell, and particularly the loss of smell with COVID is something that can distinguish, do I have COVID or do I have the flu? But most people that do test, they can test for the flu and COVID at the same time. So I want to urge people to get tested early. I do think for people of color, Black and Latino people, we just have this, we don't want to be sick. We don't want to have to miss work. We don't want to have to go to the doctors. We don't like the way we're treated when we go to the doctors. So we tend to put off going to the doctor for anything. We don't want to get tested. We have all this misinformation. We think we can get COVID from getting the test. You can't get COVID from getting the test. So I want to encourage people to get, if they think that they're sick, to be tested and then go into quarantine. The reason why you quarantine is because you help keep other people from getting the virus.
And I would just like to shout out to our young people. Many times they say, oh, they're not going to get real sick from this, or they don't think they're going to get sick, or if I get it, I'll just suffer the consequence. But most of us still have our grandparents. We still try to interact with our grandparents. The holidays are coming around. You do not want to give this to your older people in your family. You don't want that burden on your head. You don't want to know that you were the one that caused it to spread through your family. So even though you may feel okay to be with your buddies out on the streets and hanging out and doing whatever, realize when you go home, as Rhonda said, many of us live in multi-generational families. And so when you go home, you are going to take that virus back in your home, and you may not be having any symptoms at all. Your buddies may not be having any symptoms, but you walk into your house, you spread that germ, and then everybody else is sick. So tell all your buddies, we just need to slow down, stay away from each other, and do what is only necessary right now and get through this so that we can have our families around much longer.
Thank you both so much. This was, I feel like, one of our most informative shows. I really appreciate the guidance, I think, in this time right now. And you both said it, it's so much information out there. We really need to connect with folks that are experts, folks that are been in the medical industry for a long time, folks that understand the science behind some of the stuff that we're dealing with. You know what I'm saying? Like, no disrespect to the, the YouTube, theorists, you know what I'm saying? Like, I feel like it's really important for us to get, people that we can trust, people that are from our community, been in our community, have been doctors, but really care about us and care about our condition and our well-being. And I feel like, all the folks that we brought in from the Gateway Medical Society have been folks that really have that real care and consideration for our community. So I want to thank you all for your advocacy. I want to definitely say that, follow Gateway Medical Society on Facebook. You can follow their Facebook page. There are other stuff that we do follow. Dr. Johnson gives us updates, YouTube updates as well. Follow her page, and stay tuned with One Hood Media and what we have going on. Just for real quick, we're doing two toy drives this week. One in remembrance of a young man that was killed by the police in Wilkinsburg, Ramir Talley. We're doing that December 19th with a lot of other organizations in our community, Take Action Mon Valley, APA, Pittsburgh I Can't Breathe, and others. And then Young Black Motivated Kings and Queens. You can say shout out to the young people, a group of young activists in our community. They're also doing a toy drive, a grab and go. This is, you don't, when you're not gonna mingle, you got to come in with a mask, you grab it, and then you go, get out of here. So, all of these, we're trying to respect social distancing and all of those things, because we don't want to, in the spirit of the holidays and trying to help people, get people more sick. You know what I'm saying? That's something that we do not want to do. So thank you all for constantly reminding us to take these precautions, and appreciate everybody that tuned in. And we will see you all, I guess, maybe at the top of the year. Is going to be our next episode. So we'll see y'all after New Year's Eve. So don't be out, with a whole bunch of people maskless in the club on New Year's Eve either. We're going to let you know that right now. You know what I'm saying? Celebrate at home in your bubble. You know what I'm saying? Bring in the New Year safely and healthy. You know what I mean? Thank you all.
Thank you.